Good afternoon and welcome to Find Out Friday, part of the ThinkTech Hawaii series on KGU 760 AM. I'm Kayla Rosenfeld. Domestic violence. It cuts across ethnic, race, class, religion, education, and geographic boundaries. And because it's inflicted most often by a family member or an intimate partner, the violence violates the most personal of all human rights. Here in Hawaii, domestic violence statistics sort of parallel what goes on the mainland, whether that's for good or bad, but our cultural diversity also demands that educators and advocates use different sets of tools to work with island families. Today, on Find Out Friday, we're going to hear how historical trauma and cultural norms contribute to the violence against women in Hawaii. And helping us with that conversation, we have asked Nanci Kreidman, the CEO of the Domestic Violence Action Center, to join us. She's here in the studio, and we've invited her to discuss facts, trends, and advocacy, and to explain to us why political will is vital to breaking the cycle of violence. Nanci, welcome to the program.
Thank you. Thank you.
So Nanci is organizing a conference on domestic violence September 10th and 11th here in Hawaii, and the conference has a special focus on women in the Asian and Pacific Island communities, and we'll get back to that in a moment. But the primary purpose that I'm bringing up the conference is your promotional material describes violence against women as a community health issue. I'm going to repeat that. It's a community health issue. Yet many people across the world, in this country, in this state, treat domestic violence as a private matter. And the way I understand it, that's one of the challenges of seeking and receiving help and one of the barriers to educating the public at large. So Nanci Kreidman of the Domestic Violence Action Center, what do you think it'll take to move a private issue like domestic violence into the public arena? In other words, what does it take to convince the general public that this is a community health issue and not a private one?
Mm-hmm. Well, it's wonderful to be here because one thing that we have learned over the last 25 years or so is we have to keep having this conversation, and we have to keep having the conversation in new ways with new voices. So right now we're trying to place an emphasis on the idea that this is a health issue. Historically, we have done some good work in the criminal justice and the civil justice systems. But we are feeling the need to reach farther out into the community to get our healthcare providers and our healthcare practitioners to join the conversation and to become a part of the solution. So when you think about families seeking healthcare, either through a private practitioner or a clinic, it is a perfect opportunity for a conversation to take place. Mm-hmm. That could be a point of entry for a person, could be an opportunity to exchange information, develop a safety plan, make referrals, which is mostly not taking place right now.
Okay, now when you're talking about health care or health plan, we're not just talking about the physical body, we're talking about the emotional body of the direct victim or survivor, as well as those who are affected by that activity.
Yes, there's absolutely an emotional dimension to this, but I'm also wanting to highlight and lift up the importance of recognizing that there are health consequences, and that goes far beyond an emergency room visit. But there has been research done in the last couple of years that demonstrates that victims do have other kinds of health-related consequences. Mm-hmm. They may not come in and say, I'm a victim of domestic violence, I'm not sleeping well, I'm not eating well, my stomach's killing me, I've got chronic headaches. But again, if there's a conversation that can take place, a physician or a nurse or physician's assistant might be able to focus the care and the support in a better way, in a more responsive way.
Okay, I'm hearing you use the words if, and you know, words that aren't quite committed to the process. So what I think I'm hearing then is that the process still needs work. You're saying if a healthcare person is going to talk about this.
Yes.
Okay. So what I'd like to do now is turn to a guest that you brought with you, Judy Gray. Judy is a retired professional entrepreneur, a business owner, and a mother. And she's also a survivor of domestic violence. And we are honored that you took the time to be here. We're honored that you are strong enough to come forward and to tell your personal story and hopefully share with others. So thank you so much, Judy.
Thank you for having me, Kayla, and thank you, Nancy, for inviting me and giving me this opportunity.
So we were just talking about the community health aspect. We spoke a little bit about the show, about this before the show, and some of your experiences reflected the inconsistent perception of domestic violence and response to domestic violence within the law enforcement community and healthcare workers. Tell us about that,
Correct.
if you would.
My domestic violence experience spanned over a year, and unfortunately, it took time for me to learn procedures on my own to start documenting the violence, on my own, because, as you mentioned, I was unable to get consistent assistance and interpretation of my temporary restraining order and the laws that are in place by the various police officers that would be sent out to the calls that I made to 911. And it became really frustrating. As Nancy mentioned, and you mentioned, that this really, for me, it was a private issue because of the shame that, I felt that came with the domestic violence, and which I learned is part of domestic violence. And really, as I, experienced this over and over, and I was put in contact with the Domestic Violence Action Center. I began to receive the support, the emotional support that I needed to be strong and to put my foot down to realize that this isn't my fault.
So that's my question for you. What was the turning point for you? If you want to share, what happened and what was the point that you said, okay, enough, I'm taking a step?
Well, the abuse, the physical, the emotional, financial abuse was going on for quite some time. And I had an advocate that was assigned to me through Domestic Violence Action Center. She was very, very supportive. She was there with me, in court, while I was emotionally unstable. She supported me. And she reminded me that, you do not need to live this way. I also did finally find a therapist that helped me to understand that I do not need to live in a domestic violence relationship and that there is a way out. So, with the help of DVAC and my therapist and my physician, because as Nancy mentioned, there are other health issues that come up. I was diagnosed, and I do have post-traumatic stress disorder. And, unfortunately, it took such a long time to finally find a team to support me in that way, to finally say, you know what, enough is enough. I want my freedom back. I want to be able to live my life, and I physically cannot keep running. Because basically,
so you were literally running.
Oh, literally.
You used the shelters.
Oh, I've been to the shelters. I've stayed with friends. I stayed with family. Times when I left with literally just my son on my left hand, my purse on my right hand, no medication for my current medical issues. But I just needed to get out, and I needed to be safe.
And what is the status, if I may ask, what's the status of your case right now?
He is currently incarcerated, awaiting trial on 6 different counts, 3 of them being felonies. And we do have another case for a violation that was done back in May of 2011 that is just coming to court now. So there's two separate cases coming.
What about your children? Where are they?
My children are now safe. My oldest child, moved out of the home after she continued to see the domestic violence and couldn't understand just as much as I couldn't understand, why was I tolerating this? Why did I keep forgiving and saying he's going to change? She ended up leaving the home, and basically she said, Mom, you can't call me from the grave. You know, I need you, you can't call me. And so she left, and so now I have my son with me, and we had 5 children together. We had a blended family, and each and every one of them have been affected in some way. If you sit and you listen and you watch them, you know, you can tell that they've been affected.
What was your feeling when your daughter said to you, Mom, you can't call me from the grave? How did that make you feel?
It broke my heart. It broke my heart because I knew she was right. You know, and that statement made me stop and think that for my issue, this is not necessarily about me. I need to do this not only for myself, but for these 3 young children that I'm responsible for and need to raise. And no one's going to be a better mom than I am. Mm-hmm. You know, they may end up, you know, if I'm not here, they may end up finding another family, but nothing replaces the love of a mom or the love of a dad. You know, so it did break my heart. And, you know, we've, now that my husband is not in my life, he's incarcerated, I've been able to rekindle and rebuild the relationship with my children because they were angry with me for tolerating it.
Absolutely. That was going to be my question. What kind of conversations do you have now with your children? Are they proud that you've made the move?
Oh, definitely. My family members have, you know, have done nothing but support me and just letting me know how proud they are.
Okay, we'll talk more with Judy Gray and Nanci Kreidman when we return from our break. This is Find Out Friday, part of the ThinkTech Hawaii series on KGU 760 AM. I'm Kayla Rosenfeld. Please stay tuned. We'll talk to you in a moment. Doing good. Doing very good. Thank you. Doing really well. Okay, let's all take a breath. Okay. I am so proud of you. I am just in awe.
I just need to, I mean, I feel very, very strongly about this. You know, now that I can step back.
You can hear it. You can feel it. You can feel the power coming from you. You're giving me chicken skin.
I could hear the music coming on, so I knew it was time to.
Yeah, very good, very good. Now, I see something Asian American, American Indian. Are you American Indian?
I'm American Indian, white Filipino.
Okay.
So then we're going to the socioeconomic.
Born and raised here?
Born and raised here. My mom and dad were not very educated. You know, my father came here in the war. My mom went up to 8th grade, worked in the plantation. You know, had 10 kids. I'm number 10.
Holy cow.
You know, so they didn't have too much education.
Yeah.
You know,
but was it a loving environment?
Oh, definitely.
So no domestic violence?
No domestic violence.
ThinkTech Radio was also brought to you by Inter-Island Solar Supply.
10th child.
Holy cow.
Renewable energy equipment distributors in the world. For the past 4 decades,
Did you know that?
Hawaii's
yeah.
leading
You knew that.
design
But I thought he
professionals,
changed.
contractors, and
Right.
builders have relied on
Because he
Inter-Island
married an angel.
Oh.
patient support and its very large stocking inventory. Inter-Island has represented the most respected manufacturers in renewable energy, assuring its contracted customers that they are installing the best program-backed energy systems.
Hello? What? You want me to talk?
Inter-Island Solar
I was just saying hello. Sorry.
ThinkTech Radio was
I was just saying hello.
since its inception in 2007.
Yes, Leah. Okay, that'd be great. Tell her we will pick her up in 5 minutes. Thank you, Leah.
It's the only school. After launching in the U.S. and Europe in 2010, InMobi has more than doubled its mobile
So I'm going to go to
I'd like to see how I look.
somewhere else. You okay?
Yeah, I'd like to see how I look. I know, but I can't see. I can only see like that part of me.
San Francisco, Seoul, Singapore, and Tokyo.
Thank you. Welcome back to Find Out Friday. I'm Kayla Rosenfeld. You are tuned to 760 AM, KGU 760. Today on Find Out Friday, we are talking about domestic violence, how to break the cycle of domestic violence, and about a conference that's coming up in September that will provide advocates, survivors, and anybody else who wants information with some really solid information and skills to go away with. Before the break, we were speaking with Judy Gray about her experience. Judy is a strong survivor of domestic violence. She was talking about the experience she had with her husband and her children and what has happened since. And when she wrapped up, she was talking about the importance of community and support. We have on the line now Maureen Kim, who is from the Hawaii Judiciary. And Maureen worked back in 2004. She was part of a planning committee that worked on a resolution to improve the outcome for children and families affected by domestic violence and child maltreatment. And I asked her to call in because I'd like to check in on where that resolution is and where the Hawaii judiciary is now that we're 8 years down the line. How far has the judiciary system come in terms of protecting survivors of domestic violence? Maureen Kim, hello.
Hi, Kayla.
Hi.
Thanks for having me.
Thank you so much for being here.
Thank you. Well, since 2004, we worked on that resolution, which still exists, and we're still in a step between the Homeless Kids Coalition and the Department of Health and Human Services. And that was that children and victims were away from the system. But since then, and it's been 8 years, we have continued to work closely with the Department of Human Services when domestic violence has been keeping this issue alive. In fact, the committee was formed earlier last year or late last year, and there's been training involved, and it was just a matter of just trying to help people become more aware of this issue and to assist the department and their line staff, especially in responding to victims.
So responding meaning identifying victims or survivors of domestic abuse?
Yes, and taking it one step further, looking at what does the victim need in order to make it possible for her to take care of the children so that we don't have to remove the children from her care. If one is not an abuser, there's a flexible challenge. Trying to get the victim to look beyond the usual parameters.
I see. So you said the judiciary has been working with Department of Health and Department of Human Services. What have you had to bring in any kind of new programs, or is it a matter of just training current staff in their current positions?
It's more the latter. It's more a matter of collaboration, coordination of services. Sometimes there are joint trainings that everybody can attend. Sometimes there are specialized trainings for different selectives, like for example, in the case of the judiciary, we will be having an annual family court symposium in 2 weeks. The focus of that will be the effects of domestic violence on children and victims, and how judges can better respond to their needs.
Okay. Are you able to identify, Maureen, in terms of working with service providers, like state workers or the actual program service providers, were you able to identify the weakest area in support for survivors of domestic violence? I know that there's probably a lot that you can go through, but is there a weakest point that you felt needed immediate addressing?
Well, I think for me, what I've seen in the past 20 years working in this area is the understanding of domestic violence and the victims and how it impacts children. Because domestic violence has so many nuances and layers that it is a very difficult subject to understand. And each victim's story is different. So there's no clear description of one victim, one reaction or situation. In other words, one side doesn't fit all. And that's why it's very difficult for people to respond and to oftentimes react appropriately.
Okay. Maureen, what are you doing now in relation to this particular advocacy field? Are you still working in the field of domestic violence?
Yes, what I do is I'm the person in the judiciary that handles primarily the domestic violence grants. I handle the contracts on this island. I do a lot of collaboration and coordination. I do work with the neighbor islands, and I work with some national organizations to deal with domestic violence, such as ThinkTech.
Okay. Well, thank.
And how it relates also to the issues of child custody and visitation.
Child custody, I mean, that's a big one, because I'm guessing that your primary directive is to try and keep the child in the family environment if it's safe. But the question is if it's safe.
Yes. And for the family court, the main concern is what's the best interest of the child.
Right. Okay. Is there anything you want to say that I did not ask you about in terms of what you do in the domestic violence field? Is there any other point that you feel really needs to be made for our audience?
Well, it's just that I think whoever's listening needs to just be aware that domestic violence is a really big issue, and that it's not very easy to spot for some situations. And what we say and what we do, how we respond to a victim, makes a big difference, because it can either empower her or sometimes unconsciously or inadvertently we can say things or do things that may actually empower her better.
Okay. Good food for thought to leave with.
Training comes in, and this is where we all have to collaborate with domestic violence agencies and the coalition and other resources available.
Okay, well, thank you so much, Maureen. Maureen Kim works with the Hawaii Judiciary, and we thank you very much for the work that you do and for calling into the program.
Thank you, Kayla. It was my pleasure, and good luck.
Thank you so much, Maureen. Bye-bye. So, Judy Gray and Nanci Kreidman, Maureen just brought out some really interesting points, and one of them that jumped out at me was that domestic violence has a broad umbrella in terms of how we think about it, but when you come down to it, it's really an individual experience. And she said understanding the impact on an individual and their families means that you also have to understand the nuances of a particular family, their culture, what their historical traumas are, and things like that. And I thought that was really interesting, because I mentioned in my opening that in Hawaii we have to use different tools because we have a multicultural environment. It's not, like she says, one size fits all.
Mm-hmm.
Do you want to comment on that?
Yeah, I'd like to comment on that. I think that the other aspect of what Maureen was talking about, I think, is that it's the community's response to domestic violence is embedded in a belief system which says certain kinds of people are victims, certain kinds of domestic violence looks a certain way, and so this is the formula we use to help victims. And a part of the sort of the cultural nuances and the individual nuances, I don't think she was saying that this is an individual problem.
No, I didn't get that.
Yeah. So I just wanted to clarify that for
Okay.
the listening audience, that that's what keeps it a private matter, is the belief that there's something between you and I in our individual relationship that causes you to abuse me because perhaps I've provoked you, or I have you lack certain coping skills or whatever that contributes to the domestic violence. And I think the point really is that the domestic violence is rooted in a belief system which says men have the right. I'm going to do a little disclaimer here before I go on. Most of the crimes that are reported and the domestic violence we see at the Domestic Violence Action Center involve men as the perpetrators and women as the victims. So domestic violence is rooted in a belief system which says that men have the right to have power and control over their partners, and there are expectations that women will do what their partners say. So the man is the head of the household and the king of his castle, and we socialize our children and reinforce these beliefs through music and media and entertainment. And as much as we would like to think that we've left all that behind, I'm afraid to say we haven't.
Yeah.
And I mean, go to the movies, listen to music. The messages that we are bombarded with keep reinforcing the idea that he's entitled to sex, money, power, and she kind of has to go along. She's the nurturer, the mother, the caregiver. And what we're trying to strive to achieve is some measure of equality where both men and women can experience the full range of who they are. And that means that both share power and decision making and money and access to resources and parenting. So we are still trying to peel away the layers which will eliminate the beliefs around it's an individual problem, there's something wrong with her, if it was so bad she'd leave, why doesn't she just leave? It's obvious to me that he's a problem, why doesn't she just take my advice? Rather than understanding, as Maureen said, the nuances, and as Judy alluded to, there are many, many obstacles in the pathway for a woman trying to sort out her relationship with her partner, her responsibility as a parent, her access to resources that will help her get free and safe. And that's where, again, we come full circle to the doctors and the healthcare industry. You're looking like you want me to stop soon.
Well, the music is telling us we need to stop. Thank you, Nanci Kreidman. So when we come back, we'll continue this conversation. We'll talk a little bit more about cultural influences, and also the thing that I think haunts many of us as women, we can change that person. Let's talk about that when we come back. This is Find Out Friday on KGU 760 AM, part of the ThinkTech Hawaii series. I'm Kayla Rosenfeld. We'll be back shortly. Stay tuned. Okay, what did I just say? I just said
we can fix him.
We can change it.
We can change him.
Can change.
I knew I could do that.
Yeah.
And then the other thing was cultural differences. And what I'd like to do, if you don't mind, Judy, is go to, you grew up in a really big family, and being the 10th of 10 children, potentially you were in the position to receive violence. I mean, just in terms of it, being in a really large family, not so well off, that kind of thing. And maybe I shouldn't say that, it's not appropriate. But anyway, glad I said that out loud now, off mic. How do I want to do this? You came from a family, loving, large family.
And he didn't.
And he didn't. You knew that when you went in, and you thought that you could take care of things. Yes? So coming into this next piece then, next segment, there's a vocal. So right after the vocal, I come in. Okay, thank you.
That's so awesome, this technology. Somebody way down there.
I know, isn't that crazy? Okay, so that's what we'll do. So cultural difference.
So many of these things that they were talking about and Maureen was talking about, I was like, yeah.
Okay, cultural difference. Judy. Family. Husband. He was your husband, right? Not just your partner. Husband. Not.
And the nuances and how you respond to a victim affects. I mean, it did that to me. Right. How they responded to me. And why isn't she listening? Why is she tolerating?
Welcome back. This is Find Out Friday. I'm Kayla Rosenfeld, and I am joined in the studio this afternoon by Nanci Kreidman, CEO of the Domestic Violence Action Center, and Judy Gray, domestic violence survivor and mother. Welcome to both of you again.
Thank you.
We're having a really good conversation. When we left the previous segment, we were talking about, or Nanci was actually talking about the nuances, following up on what Maureen Kim had said. And we got to the cultural differences. And something that Judy had said to us earlier was that she grew up in a really large family. Her background is American Indian, white, and Filipino, born and raised here in Hawaii, grew up in a large family, the 10th of 10 children.
Yes.
And very loving, no domestic violence in your family or anything like that.
None at all.
None at all. And then you married your husband, and
Yeah.
he had a different family background. Take it from there.
He also came from a large family. However, unlike me, it wasn't one mom and one dad. He did experience as a child a lot of different types of violence. So, like Maureen mentioned, that there's a lot of nuances and a lot of variations. So my upbringing, was very different from his. Although I knew what his upbringing was like, just as I believe Nanci had mentioned, I felt that I could change him. And if I just did a little bit of more of this and a little more of that, and I didn't say it this way, I wouldn't make him angry, and he would change. He would become more of a loving husband, and he wouldn't be angry, and the domestic violence would stop. And obviously it didn't stop. I learned that over the past year. But Maureen Kim also mentioned that what you say to a victim does affect them. So, over the past year, I've turned to my family members, I've turned to my church, I've turned to friends, and, there are a number of times where I was told, why aren't you listening to me? I told you that last month. I told you that 2 weeks ago. I'm tired of telling you that. And, it made me feel more victimized.
These are your friends and family and your supposed support system.
Correct, my support system. So not only the professionals, meaning, the police department, the judiciary, the physicians, not understand this, but even my immediate support system didn't understand that, what you say, because the psyche of a victim is just so bombarded with so many things. And, for me, it was wanting to work the marriage out. I grew up with a mom and dad who were married forever, until death did they part. And this is what I was striving for. So it was very difficult for me to give up no matter what was going on. But I felt more victimized when, I felt I was being criticized for tolerating it. I did, however, have a very dear friend that stood by me. She stood by me no matter what, and she just kept telling me, Judy, I understand I cannot tell you what to do, but I want you to know that I'm very afraid that he's going to end up killing you. And no matter what, I am going to be here for you, whatever you decide to do. And, when I eventually learned, along the way, I did stay with her and her family. And, of course, my husband did show up there. It seems like wherever I went, he was able to find me. She was very supportive. Her husband was very supportive. Her kids were supportive. And I was never criticized for the decisions I made. There was one point we had talked off air about how I learned along the way that I needed to document incidents so that when we do go to trial, I have a better chance of being protected. So there was an incident where, I was victimized, I was physically beaten, and the bruises on my face did not come out till the following day. So I did call my primary care provider and I said, hey, listen, I want to come in because the bruise came out on my face and I want it documented. Because, going through the judiciary system, they ask you, did you have it documented? Did you go to the doctor? And so I wanted to do this, and my physician told me, this is something that I don't do. You need to go to the ER. And at that time, I didn't have the financial resources to go to the emergency room, knowing if I went to my primary care provider, it would have been a lot cheaper. So I ended up not going to the emergency room because there was financial constraints that I was placed under. So, Maureen briefly talked about what the victims, or you may have mentioned, what the victims need. DVAC had helped me put together a safety plan and an escape plan. And, there were times, as I mentioned earlier, where I left literally with just my purse and my son. We had no clothes. We had, no money, no food. And I was not aware of where I could go to even get, clothes for just a few days until I could get to the bank, because I had no paperwork, for my identification. And, I learned along the way that to put together these documents, I mailed it out to my family members so that in the event I had to run again, I had these documents. I had the birth certificate, I had my driver's license and social security card, because my husband, who was the perpetrator, would do a lot of things. The abuse just went across every single gamut, to try and continue to control me. And part of the control was to financially disable me, to isolate me from my family and friends. He would call them and say, I am this, and, I'm doing this, I'm doing that to him, and I'm doing this to his kids. And of course, they didn't want to be caught in the middle. But I think if my support system, whether it be through my physician or family and friends, stood by just a little bit longer, a little bit firmer, I could have gotten out sooner.
Okay, I think what I'm hearing you say is it was there, but your support system didn't have all the tools they needed, and therefore couldn't provide you the support you needed, and in a sense did the opposite.
Exactly.
Yeah, and the consistency wasn't there either.
Exactly. I think
I don't think that's unique to you, Judy.
I don't think so either.
I think I hear lots of women say that, their family and their friends, they really don't understand.
Correct.
They don't understand what they're up against, or, how unceasing the behavior is.
Yes.
And because they only see, so small excerpts of it, or little
Right.
slices of it.
Right. And of course, as the victim, I was ashamed. So I would have bruises on my arms or on my legs. So I would wear long sleeve shirts and always in blue jeans to cover them up. So I was ashamed to really let them know what was going on.
Right.
But as, I started going through the judiciary system, and I received the support from my advocate through DVAC, I learned that, there is no reason to be ashamed. I was also, I joined Celebrate Recovery through my church. It's a national program, and they have various types of groups, whether it's various addictions, domestic violence. So through them, I've learned that it's okay. The feelings I'm feeling it's okay, and it's not because of me.
It's not because of you.
Correct.
Shall we say that together?
Yeah,
it is not because of you. Very good. Okay. May we all take that home with us, that it is not because of us. We, as women, and really anybody, most of us want to please whoever our intimate people are, our family members. And, I think we all self-doubt and all that kind of stuff, but taking it to another level, wow. I mean, that is just amazing. I'd like to sort of segue into the conference again, because the conference is going to provide, hopefully, skills in conversation that participants can take home with them. And one of the conference supporters or sponsors is the Department of Human Services, and I just want to bring them into the conversation briefly because people on both sides of the issue say, yes, the Department of Human Services helps sometimes. No, it doesn't sometimes. So what I want to do is just get a sense of the role of the Department of Human Services in preventing or trying to prevent domestic violence. And Barbara Yamashita is on the line. She is the Deputy Director of the Department of Human Services. Hello, Barbara.
Hi, Kayla.
Hi, thanks so much. So I think you've been listening to the program. How does your department fit into this conversation, and why are you a sponsor of the conference coming up?
Well, I think the whole thing that the conversation is about the conversation that affects us all. Long as anybody bringing it up, you kind of take that approach. It takes all of us to support, provide the kind of support that we need. So we're proud to be a part of the partnership with the conference coming up. We're honored to get some real great people that special thanks to Nanci feedback and for really taking leadership in putting this conference together and making sure that this kind of conversation occurs.
I know when we were speaking about the conference itself, you were interested in the fact that it does have a slight focus on Asian and Pacific Island communities. Is that something, is that an area of interest more now than it has been in the past?
Well, I think there are a number of reasons. I think for Hawaii, it was our conference. And as we see the nation deploying best practices and evidence-based models for trying to look at interventions that work and what to find people they're trying to find best practice, evidence-based models, for which there aren't any, there really are very few that address the Native Hawaiian survival American population. So, but we also know that the vision for and by the people. So this is an opportunity to focus in on some of those good things that are happening. Really build on that body of knowledge and share it with everyone and have that opportunity to build on those conversations and to better serve our population.
Okay. Well, Barbara Yamashita, Deputy Director, Department of Health, thank you so much for calling in.
Human Services.
Sorry. Sorry, Department of Human Services. You were at the Department of Health. That's where that came from. Thank you very much for your call and your participation and for supporting the conference. Really appreciate it. Okay. Okay, bye-bye. So Barbara mentioned, and you alluded to it earlier as well, Judy, Nanci, and we have a break coming up, so we'll get back to Judy and Nanci in just a moment. Find Out Friday here on KGU 760 AM. I'm Kayla Rosenfeld. We're talking about domestic violence, and please join us for the final segment coming up in just a moment or two. Stay tuned. Okay, so let's go to some of the issues of the Asia Pacific.
Okay, I'd like
Or
to
we-
mention who our partners are.
Okay.
Who the conveners are.
Absolutely.
just
Let's
so
do that.
We,
All right.
we got
Let's
DHS.
close with the conference.
Okay.
Okay, because when we come back, we'll have about 10 or so minutes.
Sure.
So when
Yeah.
we come back from the break, we'll talk about the conference and see where it takes us.
Okay.
What do you want to close with?
I don't know. Give me a minute.
Okay. I'd like to be able to cite the Native Hawaiian stuff. Part Hawaiian, part Hawaiian. Oh, and the grant that you got for the Leeward Coast. So let's try and bring that in as well, okay?
Pacific
Okay, I think I know what I want to go to.
Okay. So, Nanci, conference, Leeward Coast Grant, and I think that'll do it. If we have more, we'll play it by ear. Okay, and Judy, what do you want to finish with?
I think what Barbara mentioned was that, we have some programs that are working, I'm not sure exactly what, like DVAC, and that we need to share those best practices. I think the more we share instead of spinning the same wheel.
Well, welcome back to the program. Kayla Rosenfeld here, joined by Nanci Kreidman and Judy Gray. We're talking about domestic violence and an upcoming conference that's scheduled for September 10 and 11. And Nanci, as the CEO of the Domestic Violence Action Center, you've been running around crazy for the last few weeks trying to pull things together. You wanted to mention some of your supporters and sponsors because it demonstrates community involvement.
Yes, I would like that very much. We just heard from Barbara Yamashita, Department of Human Services. The department's been an enormous support and beacon of light in developing the conference. Kokua Kalihi Valley, which is a community-based health clinic in Kalihi, they are a partner of ours. The Hawaii State Coalition Against Domestic Violence, the Maternal and Child Health Branch of the Hawaii State Department of Health, the Medical Legal Partnership for Children in Hawaii.
Okay, and those are two industries that we had mentioned, saying that there needs to be a little bit more consistency and regular training, collaboration. Yes, thank you. Okay.
The University of Hawaii School of Nursing and Dental Hygiene and Queens Medical Center have all come together to plan and coordinate the Pulama I Ka Ohana, which means cherish the Ohana. It's the name of the conference. And the idea, again, is that violence against women is a community health issue impacting Asian and Pacific Island communities. We haven't done enough talking about it. And with the funding support of the Office on Women's Health, which is a federal agency, as well as some funding support from some of those that I've just mentioned, Kaiser in addition, and DHS and DOH, we are trying to bring together a unique combination of our community professionals, community activists, healthcare professionals, domestic violence professionals. Earlier you said that people who came to the conference, advocates and survivors, would be provided with more skills. We're really hoping that our allies in the healthcare field, whether they're a clinic, a physician's assistant, a nurse, or a doctor, or a policymaker interested in health policy and health practice, this is a conversation that's long overdue. Again, women go to their doctors who are victims of domestic violence and either are not invited to talk about domestic violence because of the discomfort of the practitioner.
Imagine the victim's discomfort.
Yeah, which is why victims wouldn't necessarily volunteer the information.
Right.
But if it's a routine question, this is something I ask all of my patients. Are you safe at home? Are you afraid of your partner? As an invitation to them to talk about it. We very much want to inspire our healthcare community to work right alongside with us so that they can join the rest of our community allies, courts, police, legal, child welfare, business.
Can I just sort of defend for a moment the healthcare industry in certain places? I can't speak for everybody, but I was talking to a friend of mine about this subject and telling her that you felt that there was lack of partnership and collaboration between domestic violence issues and the medical community. And as a nurse, she got kind of upset, saying that that's not the case, because where she goes, every time somebody comes in, she asks them, like you said, are you safe in your home? Do you feel, threatened by a partner or anything like that? She checks them for their body, for their bruises, hand marks, those kinds of things. An elderly person, their arm is twisted, You can guess something. So you're not, are you saying across the board that the medical profession isn't in collaboration or is just not consistent? Let's be clear about that.
I would say it's very inconsistent, and I would offer my gratitude to her for her responsive and well-informed care. I don't think that is universally done.
Okay.
The Institute on Medicine last summer issued some recommendations relating to mandatory universal screening and assessment of all patients. That would make an enormous difference. But I think what your friend is doing is not matched by a lot of other professionals. Look what Judy's doctor did.
Right, exactly.
Didn't even want to see her.
Right.
I mean, that's heartbreaking to me.
That's, yeah, kind of unacceptable. Okay, we only have a few minutes left, and I want to give everybody a chance to close. So you were talking about not much research being done on women in the Asia-Pacific community here in Hawaii. You did get a grant through the Office of Women's Office on Women's Health for a study on the Leeward Coast focusing on Filipino and Native Hawaiian women?
It's not a study. It's community mobilization
Okay.
on the Leeward Coast with Filipino and Native Hawaiian communities.
What does that mean, community mobilization?
To get the community on the ground better aware of the problem, more engaged in addressing the problem within their cultural communities. Again, if people are keeping secrets or given the implicit instruction that we don't talk about this, then people won't go to their family members or their neighbors or others in their cultural community to ask for help. And if you do come to me for help and I don't know what to do, then we're both at a loss. So we are trying to follow the direction of the community. What do you think would be good in your community that would help your families? Because again, as a person in town, Caucasian, going to a rural island community that is not my cultural group, I have to listen and I have to take direction as to how best to support them in working together in their community with their families. So that's what the work is. It's really, really powerful.
Community mobilization.
Yeah.
Okay.
Yeah.
All right. I believe, Judy, you're going to end up with the last word on the show today.
I just want to again say thank you for having me here on the show, and thank you very much, Nanci. You know, Barbara Yamashita did mention that there are some programs out there that do have best practices, and I just want to say that you are part of one of those programs. Do share that information, because domestic violence is very real, and it goes across the whole gamut of socioeconomic communities and families, and it is a difficult subject to talk about, but even more difficult to live with. But I think if we all collaborate together, share best practices, share information, and be proactive in learning and gaining knowledge by attending the conference, we're all going to benefit. And I think, you know, bottom line will be that we gain these skills now. We're going to raise children that will have better skills and not be prone to be perpetrators or victims of domestic violence.
Well, on behalf of those of us who continually seek to learn, to grow, and to be of service, I thank you very much for sharing your story with us. It took a lot of guts, I think, to come forward, to make the step to leave the situation you're in, to come forward and to speak about it. I got chicken skin. Thank you so much, Judy.
It's my pleasure. Thank you. Thank you.
And Nanci, thank you for bringing Judy.
Yeah.
And I learned a lot today, and I hope our listeners did as well. And I'd very much like to leave our listeners with a couple of suggestions, just in terms of recognizing that domestic violence is a community health issue. A couple things that you can do if you are aware of domestic violence around you. Simply get involved. Don't just leave the situation. If nothing else, and these are things that are suggested by professionals and advocates. This isn't my opinion, but they make sense to me. If nothing else, at least let the person who is being victimized, know that you recognize it and offer assistance if you can. If you can take the person to a safe place, go ahead and do that. You know, don't throw yourself into the situation, make it worse, but if there's something you can do, do it.
Please do it.
Please do it.
Yes.
This is a community health issue. And thank you very much for tuning in to Find Out Friday on ThinkTech's series, KGU 760 AM. I'm Kayla Rosenfeld. Next week, we're going to talk about foster kids, a makeup program for the technical problem we had a few weeks ago. Please tune in. Questions or comments, write, call. Thanks for being here. I'm Kayla Rosenfeld. Talk to you next week.